Hi, Dr. Richardson here at Texas Facial Aesthetics. We do a lot of cosmetic surgery, but we also do a fair bit of reconstructive surgery as well. So we're doing a reconstructive procedure for a nasal skin cancer today. This patient had a basal cell carcinoma on his nose, and this was removed earlier today by the Mohs surgeon, our local dermatologist that we work with. And so we're going to reconstruct his defect now. So I just want to show you how we do this. There's a lot of different options for wound reconstruction. Of course, we could leave it open and let it heal, but that would take several months and cosmetically would not look good. We could also put a skin graft on here, but again, the cosmetic result would not be very good because the skin would not match. So in this case, and in most cases, we use a local tissue flap or an adjacent tissue transfer to reconstruct a defect like this. So I'll let you zoom in here and you can see exactly how we're going to reconstruct this defect. So you can see this defect here is about 1.5 centimeters in diameter, basically a circular defect, and we're going to borrow some tissue from right next door to fill this defect. So we're actually going to use this little finger-like projection here that I've marked out, this little local flap, and we're going to take this bit of tissue here and we're actually going to rotate this to fill this defect. Okay, so this point here will now be here, and we're probably going to take out this little bit of excess tissue here in order to allow this flap to rotate. We'll then use this secondary flap to fill in where the donor tissue came from. So this flap is called a bilobe flap, and there's a lot of different variations of local flaps that we can use both on the nose and in other areas, but this should do great, and we'll leave a very nice cosmetic result in the end as it heals and the scar matures. We're all finished now. We've completed this nasal reconstruction. We've used a local tissue flap here, a bilobe flap, and we'll let you look closely at this here. But basically the two lobes of the flap that we had marked out earlier, we've taken both of those and rotated them down into the defect here. The secondary flap has filled the original donor site, and we've got them all closed up. So a little bit of bruising and swelling, but pretty minimal overall. These sutures are going to come out at 1 week, and then it's just going to be a little bit of a waiting game for this scar to mature. But overall, we've kept his nasal shape and contour and not really changed anything there. So he's going to get a beautiful result. Once this scar matures and fades, it'll be like nothing ever happened, hopefully.